Okay, we're going to start, I think. So you can, so, hi, I'm Glenn McRae, the Associate Director here at the TRC. I'd like to welcome everyone and welcome our guest, Jack Conry from Fletcher Healthcare. I'm actually kind of personally excited about this. I've done extensive work in the healthcare sector, both nationally and globally, and one of the interesting things has always been is how these facilities are able to stay open 24/7, 365. Not only how do they, but the fact that they have to. They have to remain accessible to people, both their staff and the patients, the people who actually use the services, as well as open to receive all of the materials and accessible to everything they need to be fully operational. So it's they're very dynamic and very complex types of institutions. They're usually the largest institution in their community. And they have a myriad of transportation issues that deal with it. And it's probably one of the more complex transportation systems that have to be managed, certainly in Vermont. Jack's been at Fletcher and the University of Vermont for more than 30 years now, dealing with a whole host of different facilities, transportation, security issues. He's currently the Director of Security, Safety, and Parking, an interesting combination at Fletcher Healthcare. If you don't know, Fletcher just became, I believe, the largest employer in the state now, about twice as many employees as UVM has. It operates facilities all over in Vermont, northern New York, and do you have a facility in New Hampshire? No, not yet. So just northern New York and but getting there. There'll be other partnerships and a whole bunch of different partnerships with other facilities. Here in Burlington at the main campus, they have to facilitate 61,000 visits to the ER alone, just one of the functions that they do. And so we've invited Jack to come in and talk a little bit about that system, about the challenges that that system has faced in the past, some of the things that they're looking at now, and some of the innovations they're hoping for in the future. To kind of give Jack a sense of who he's talking to, if we could just quickly go around and introduce yourself and your affiliation or association here. And I'm going to be sending around a sign-up sheet. Just take a minute to just sign in. That'd be great as well.
I'm Tim. I'm a grad student here at the TRC. I'm working on the Urban Sim project.
Brian Lee, Civil Engineering faculty.
Katma, working on South Burlington TDM strategies.
Sandy Tebow at Katma, of which Fletcher is a founding member, campus area TMA.
Lee Solomon Hall, I'm also a professor in civil engineering.
Grad student here at TRC. And Michelle, I'm a grad student here at TRC and the MPA administration.
Chester Harvey, grad student here at TRC, and I study livability and urban settings.
North Brazil, I work at the Vermont Department of Health.
Susanna Weller. Sorry. Amanda Hanaway-Cranty, I work here at the TRC as a program manager for a couple of research labs.
Jim Sullivan, I'm a research analyst at TRC.
Julio, I'm a faculty at the School of Business Administration. My major is Corporation Fiscal Communication Management.
Sean Neely, I'm a research assistant. Jake Winkle, the business manager here at TRC. And Jeff Batista, I study Medicare access in rural areas, and I'm a grad student here.
Okay, thank you. Take it away. Okay, thanks. Glad to be here, and I thought I'd start out with a go to the next slide. So I figured I'd start out with a quick overview of Fletcher Healthcare, which Glenn kind of started. So on the slide at the bottom, you can see where Fletcher partners are. We've got 3 partners, and we also have some collaborative relationships with those institutions listed below. But mainly I wanted to talk about the numbers on the right-hand side. which basically show what we provide parking and transportation for. So Fletcher Allen has over 7,000 employees. We basically have 3 main campuses. We have lots of satellite campuses, outreach clinics. We have 562 licensed beds, outpatient visits. You can see there's 51,000, and emergency visits, which are around 61,000, and the physician encounters over 1 million. So you can see it's a pretty busy place, and the medical center campus is our main campus, which you see pictured here in Burlington. Down at the bottom, right-hand side is the medical center campus. You can see UVM is over to the left, and Lake Champlain towards the top. So I figured I'd start out by explaining what our basic premise is for our parking plan. And basically it is patients come first. So everything we do, we try to do to preserve parking for our patients. The slide over on the right-hand side, or the picture on the right-hand side, is what we try to avoid, those types of congestion. So that's a picture of our underground parking garage and cars coming out of the garage later on in the afternoon. One of the problems that we have is we merge some employee parking in the garage with patients. So sometimes when people are all leaving at the same time, we get some backlog. And I threw the picture on the left in there because we also do valet parking. We park about 150 cars a day, Monday through Friday, through our valet parking system. And this truck pulled up one day looking for parking assistance. So I had my security manager, I said, snap a picture of that. So we ended up lifting a gate and giving him parking down in the south parking lot. So I thought that was kind of funny. So what I wanted to talk about today, the Fletcher Allen overview, which we've already done. I wanted to talk about what Fletcher Allen, the security team, the parking team, how we do parking and transportation at the medical center campus, how we do staff parking assignments, what we do for transportation demand management, the types of incentives that we give, the challenges that we face, and then what I think is happening in the future. And the picture on the right-hand side shows a map, and this is something that we give to staff who are assigned satellite parking. So one of our satellite parking lots is the Catamount East lot, which is behind the Sheridan. So it gives them also on there the shuttle hours and directions on how to get to the medical center campus. So the security team, which also manages parking, we don't have a separate parking and transportation department. We have 45 FTEs, so 45 employees, 3 main campuses, as I mentioned. The UHC campus, which is in Burlington, we have security there 16 hours a day, Monday through Friday, and we have curbside service 8 hours a day, so we have somebody greeting patients and visitors that come to the front door. At the Fannie Allen campus, which is in Colchester, we have security there 8 hours a day and 48 hours on weekends, and we provide curbside service 8 hours a day, Monday through Friday. At the medical center campus, again, as I mentioned before, the biggest campus, we have security there 24 hours a day. We typically have 6 security officers on duty. 2 of those security officers are always stationed in the emergency department. We have curbside service about 10 hours a day, 7 days a week. And at peak times, we always have 2 staff at the front door assisting patients. Valet service is about 10 hours a day, Monday through Friday, and we have 4 people providing that service at peak times. So that's kind of an overview of security and the parking team. I can point out here, too, this is the front of the ambulatory care facility, which is the main entrance to the medical center campus. And you can see the valet staff. We've got one person actually greeting somebody who pulled up for valet. We've got somebody who's returning from our valet parking lot. And normally we have another person here who's greeting, who is providing curbside service.
What are your peak times?
For valet, it would be like between 10 and 2. If you're talking about parking, our staff parking, our peak time is in the afternoon from, say, 2 to 3. So that's when shift change is. We don't have enough people leaving to accommodate the number of people coming in for evenings. But peak patient time is probably 10 a.m., 10 to 2 a.m., 10 to 2 p.m. So this is a bird's eye view of our campus, and I figured I'd just point out some of our parking areas. So this is the medical center campus. This is the hospital side of the campus. And this is the ambulatory care facility, the front entrance, which I was just pointing out. Down here is the McClure building, and this is the old front entrance to the hospital. The McClure parking garage is right here. We park residents, mainly residents in that parking lot. There's 300 parking spaces. It's a garage, actually. And I've outlined the underground garage. So this is the one we started out with, where you can see the cars coming out of the ramp. We have approximately 1,300 parking spaces in the underground garage. This is what we call our south parking lot. This section here is valet parking, so it's striped and marked reserved for valet. So none of our staff park there. This is mainly staff and position parking here. Then there's about 500 parking spaces in this parking lot. The other notable lot is this small little lot down here. There's about 50 parking spaces there, and that's the parking lot for the emergency department. Yep.
Will you talk later about how CCTA services your site, or is this map a good time for you to divert for that? Because I moved here 7 years ago, and I couldn't imagine how it had become so convoluted, and maybe you have a vision for how that's going to be more seamless in the future.
The CCTA bus stop?
Well, the way that, the backtracking that goes on in order to service that stop is...
I don't have any suggestions for that, no. I mean, it's a CCTA question.
Right.
We have a stop which is over right about here. So you're pointing out that to service this one spot, which services UVM as well as the medical center.
Yeah, they come in off Colchester, go all the way around, and then go back out, even the express buses that are headed out to Essex, and it just seems like there's got to be a better way,
Yeah. There's only one way, there's two ways to get into this campus. One is the Colchester Avenue, over, which is over here, and then over here, which comes from the interstate, basically East Avenue. Any other questions about when I have the whole campus up? Okay, so our transportation demand management program, basically two goals, reduce single occupancy vehicles and reduce vehicle trips to Burlington. And I included this picture here. This is a picture of one of our yellow school buses. Anytime during the day, we have 6 buses running, or probably at peak times, we have 6 buses running from our various satellite parking lots. So this shows a picture of a bus coming into the McClure entrance, which is where and I'll talk a little bit more about that in the future, where our staff bus hub is. A lot of these pictures I've taken from our security cameras. We have about 230 security cameras that we monitor, and we can monitor the entire 360 degrees around the perimeter of our campus. So it's a pretty sophisticated camera system, so we snap a lot of shots from there. So the medical center campus, just to give you a quick overview, number of employees, we have about 4,100 employees who are assigned to the medical center campus. We have about 2,400 on a day shift. We have 2,100 parking spaces. That's all we're allowed to have. We know that every day, Monday through Friday, we need about 1,100 parking spaces for patients, visitors, vendors, anybody else who comes to campus, which means we have 1,000 parking spaces left for staff. So if you do the math, it gets scary. So as I said before, we had 2,400 day shift employees. We have 1,000 parking spaces for our staff, which means we have a shortfall of about 1,400 parking spaces every day. Not everybody works Monday through Friday, so we estimate we have about a shortfall of 800 parking spaces a day, which is what we do for satellite parking. So we satellite park about 800 people every day. So to get on-site parking, there's certain criteria. First of all, if you're a physician, you park on-site. We have what's called a business need process. So if you're an employee who needs to come and go from work frequently during the day, and you have a supervisor and a vice president's signature saying that you need that, you'll be considered for on-site parking. So that's the first step. So, and we are for the business needs parking. We scrutinize it pretty much. So we may give somebody a business need parking pass to get in through the gates that you're seeing there. And then 6 months from now, we'll monitor that gate. We'll monitor that card activity to see if you're actually coming and going. And if you don't come and go, like you say you did, we take away your business need parking assignment. We also have medical needs, which is very challenging for us. We get medical needs ranging from motion sickness on the buses. I can't ride the bus because of motion sickness. pregnancy, hip replacements, knee replacements, all the way up to the smell of coffee makes me sick. I can't go on the bus. So all of those are challenging to try and weed through people who really need the medical needs. Carpooling. If you carpool and you have 2 people in your car, you can get into campus, get onto the on-site campus. And everybody who has a carpool is assigned a card to this gate. And what we typically do in the morning when we know our carpoolers come in between, say, 6 and 8 o'clock, we have our security dispatcher watching this gate. So we can also watch if people swipe their cards to get into the lot. So as they swipe their card and they see a carpool card come up, they look at that. They can actually zoom in, look at it, make sure that there's 2 people in the car. And if there's not 2 people in the car, we jot down the carpool tag number, and we follow up with it. They actually lose their privilege for 30 days. If it happens again, they lose their privilege completely. All evening, night, and weekend staff park on site, and all others, and I put this in red, is data hire. So if you're not a carpool, you're not a physician, you're not a business need, you're not a medical need, we assign people to the on-site parking lot by their date of hire. And right now it's at 21 years. So you need 21 years at the medical center campus or at Fletcher Allen to get an on-site parking pass. So you'll see why we have so many carpoolers and those types of things, because people want to get that on-site pass.
What about physicians who walk? Is there still a reserved spot for them or no?
We don't reserve spots, so we give you a card to get into the lot to look for a parking space. And the way we monitor it, which is a good lead-in, we actually do empty counts in our parking lots, all of our parking lots, every day, twice a day, in the morning around 9 o'clock, and then again at around 2:30. So we keep a chart, we keep a large calendar in our office, and we can see how many empty spaces there were in the McClure garage, how many empty spaces there were in all of our lots. And if we see that that's trending, like say for 30 days or something, we've had 30 empty parking spaces, we may move 10 people into that lot. So we always have a waiting list based on date of hire of people who want to go into different lots.
And so the carpoolers, to register as a carpooler, do you have to have multiple people who work for Fletcher Allen both assigned?
Yes. You can only be in one carpool.
Right.
You can only be in one carpool, and you need 2 people, 2 Fletcher Allen staff to get that on-site pass. And we also give, and I'll talk a little while about incentives. We also give gas coupons for that.
Does this overlap with employees of the medical school, et cetera? Like how far is the breadth?
If they're a Fletcher Allen employee.
Okay.
Fletcher Allen. Yeah. Interesting story too. We also catch people who try to circumvent our system. So, for example, it's not unusual for somebody to swipe their card, put the card on top of the thing, on top of the swipe, go into the lot so the person in back can follow them in so they swipe the card again and get in. So again, we check, and I'm going to talk about how labor intensive our enforcement is, but we also check for double swipes. So we look for double swipes. We get alerted to double swipes. So we watch for those as well. You go pretty ingenious. Just quickly to talk about our shuttle system. So the McClure lobby, which used to be the old entrance to the hospital, is now our shuttle stop for staff. And you can see a picture coming. The first picture up on the top left shows people going out to the bus stop. You can actually see one of the yellow buses in the background there. You can see the bus leaving. So that bus is leaving to go to one of our satellite lots. What we also have over here, we have a lighting system. So each of these, so as the bus driver is coming down the hill and they get close to the McClure entrance, they press like a garage door opener, and that lights up, and you know the Fanny Allen bus is approaching, the Catamount bus.
That's new, right? I just noticed it today.
It's probably 6 months maybe,
Okay.
but yeah, it's been a big hit. People really like it.
Can you tell us anything about, I don't know whether it's within your domain, the sort of the idling emissions associated with those school buses and how that entrance is engineered to deal with that, especially related to indoor air quality?
Well, I know that we have an agreement with the buses that they abide by the city of Burlington's idling policies.
But you don't ever do any testing or anything or
We have industrial hygienists that actually work in security and safety. So if we get any kind of an indoor air quality complaint, we go and test them. But the engineering of that front, I couldn't talk about how it was.
We have a large, there's nobody represented from that here today, but we have a transportation air quality lab associated with the center, and there's probably students, if you have any data related to that, students probably be very interested in that.
Yeah, I don't know if we have any, regular data on it. All right, so some of our transportation demand strategies. Well, first of all, I've already talked about we have limited on-site parking, so we're kind of forced into satellite parking. We encourage carpooling, as I talked about, public transportation, and we also have incentives for people to participate. In carpooling, gas coupons and on-site parking. So gas coupons are 50 cents per person in the car. So if you have two people, you get $1 a day for carpooling. Another funny story was our dispatcher today was watching the carpoolers come in. And he zoomed in on the car, and I heard him talking to somebody else in the front office saying, look, there are 6 people in that carpool. they don't even have 6 seatbelts. So people take carpooling very seriously.
I have a question about carpooling. You said that you can only be in one carpool.
Yeah.
Is that helpful, or does it ever hurt the mission? I mean, if you're in a carpool and they're not driving, or if it's a smaller carpool, I don't know. Any thoughts on that?
Yeah, I do have a lot of thoughts on it because to manage it, we have to have it that way. We don't have that big a staff where we can actually check up on everybody. Believe it or not, there are people who are in carpools, and our carpool system doesn't include if you park in a satellite lot, pick somebody up and come to the campus and get on site. You have to actually pick somebody up in the community and come on site. So we have people who actually go to a satellite lot and pick somebody up on a sidewalk and come in just so they have 2 people in the car. Mm-hmm. So we get to know most of our carpoolers. Mm-hmm. So it's an enforcement issue. Mm-hmm.
And how many groups are there?
I'll go to that in a second.
Are there other incentives for people who, like you said, walk or biking?
Yes, I'll go to that in that. So we also have the emergency ride home program, which we coordinate with CATMA, so we do a lot of collaboration with CATMA. Transportation subsidies, CCTA, 50% for local and 25% for the Link Express. So here's our numbers. So as I said, there's 800 staff that park at satellite lots. We've got about 800 people participating in carpools. We have 430 different groups. 500 people participating in bike walk through CATMA. And then the numbers for our CCTA local, we have about 135 a month to buy the CCTA passes and 110 for the Link. And we also participate in the annual CATMA survey, where we can determine where a lot of our staff are coming from, which direction based on zip code and so on. So it's pretty valuable survey. And we've received some recognition. This has to do with how we link wellness with transportation. And this one is the way to go, people who pledge to do alternate terms or also alternate means of transportation. And I had to get our hybrid security vehicle in there.
This might be a tough question, but UVM provides the free CCTA passes, and I'm wondering whether you have any comparison of the statistics for ridership of UVM staff with free passes versus yours with the
we look at it through CAP.
Okay.
The costs, basically the cost is not beneficial for us.
Okay. Do you find like a similar proportion of people ride even with just the subsidy as opposed to the whole free, or would you notice, you think, a substantially?
If we were to make it free, if we were to make like UVM does,
yeah, exactly.
I don't think we gain the number of empty parking spaces to offset the cost of that.
Yeah. Okay.
So some of our challenges, I've already listed a few, and what we call it in our office is protecting patient parking. We do it every day. One of our biggest challenges is the proximity to UVM. So this roadway here where the yellow bus is kind of separates. This is UVM on the right-hand side. This is Fletcher Allen on this side. This is employees pay for parking and students pay for parking. This is employees park for free, but if you park in the garage, you pay for parking. So that's one of our biggest challenges is non-Fletcher Allen people using this garage. And the second bullet here, which I put up here, is take a ticket to get in, is we really don't have anybody screening as to come into the parking garage. So we can't tell if you're a patient, a visitor, a UVM student, or whatever. So unfortunately, we're not able to tell that. We have different methods of telling, but we can't do it as we pull into the garage. As I'm sure they have at UVM and everywhere else, there's a sense of entitlement. I should be parking on the site for whatever reason. The next bullet is kind of interesting, the distance from work. We hear this all the time, that I live in Plattsburgh, and I have to drive all the way to Fletcher Allen, so I should be able to park on site. Which means, if you look at the other hand, that means so somebody who lives in Colchester should be forced to park in a satellite lot, even though they've been here for 25 years. So unfortunately, we can't do it based on the distance from work.
Do you really have people living in Plattsburgh coming to
Yeah, oh yeah.
Really?
As a matter of fact, one of the subsidies we have, it's called an employee retention program.
Mm-hmm.
We offer 50% for Lake Champlain passes for the ferries.
Mm-hmm.
So it's a retention thing that keeps people working here. Nurses.
I know your workforce shed is incredibly expansive. You have people in Newport, you have people in Hanover, you have people in Rutland. The distance people travel is enormous.
Yeah. Which is also one of the challenges I probably should have listed here too, is that public transportation doesn't reach a lot of those rural areas, which is a challenge for us as well. Some more challenges are community traffic congestion. When one of these yellow buses gets caught in the congestion in the community, we get blamed for it. Unfortunately, there's nothing we can do, and really no answer for it. Satellite parking safety is an issue, always an issue. I do security and safety, so it's one of my big concerns. And unfortunately, we can't provide the same type of safety things that we have in this lot at our satellite lots. It's just not feasibly possible to do. So we're constantly struggling with that. For example, in one of our lots, maybe a month ago, we had a catalytic converter cut off of one of our cars. Really, I mean, we patrol them when it gets dark out in the after daylight savings. We assign security there peak times in the morning and afternoon. So we do have security sitting in those lots. It's always a challenge. The question about do you have charging stations is always a challenge for us because, again, we are so limited on the number of parking spaces that we have. Having one space or two spaces say this is an electric car parking space, I don't think it would work. I mean, we have outlets available on the bottom level of our parking garage, but we don't have charging stations for folks.
Sorry, just a question. You said that the number of parking spaces is capped. Is there a particular reason?
The air quality,
okay.
Act 250. So when we had when we added the ACC, ambulatory care facility, we had to go through Act 250, and there's an air quality permit. Air quality permit says this is the number of parking spaces that you can have on the campus. So I talked a little bit about our enforcement, how labor intensive it is. We have all different types of ways to try and protect patient parking, especially in the underground garage. So one of the things that we do is the people who are in the booth are trained to look for anybody who has an all-day ticket that looks like a student or looks like an employee. If they're wearing scrubs or whatever a student looks like. Let me see somebody who looks like a student. We'll jot down their license plate. We jot down their license plate, and we keep a record of license plates. So if that license plate shows up a number of times, we know to at least get a hold of the owner.
But if someone is willing to pay, do you have a policy against that?
Oh yeah, and it actually says it as you go into the garage. So
okay.
This is a Fletcher Allen.
Oh, so you have to use the facilities.
This is a Fletcher Allen garage for Fletcher Allen business. If you don't have Fletcher Allen business, and it says it on the back of the ticket, we put signs up in the garage, especially on the UVM side where people go up the stairs, which is where we have our cameras and we walk up. I'll tell you, we got all kinds of systems to defend patient parking. And we issue tickets, we tow, we boot, and for employees we use corrective action as well. So my predictions for the future, we're seeing a lot of bicycles. People are using other means of getting to, this is our McClure covered bicycle racks. It's packed every day. So we're always looking for places where we can put other bikes. We do have other bike racks throughout the campus, but this one seems to be the most well used. So our challenge, we're not going to have any increase in on-site parking spaces. We're limited in our inventory. We're going to have to increase our satellite parking lots. We're already talking about the need for another satellite lot for the medical center campus. One of the ones that we used in the past was out by Costco, exit 16, so one of the lots out by exit 16. Very, very popular lot. So I think we're going to get to the point, Fletcher Allen keeps growing, where we're going to need another lot, and exit 16 is a perfect example of where we could put one.
What happened to Lakeside?
Lakeside, we still park at Lakeside.
Oh, you do still park at Lakeside?
CCTA stopped servicing it. So that was the biggest challenge with that. So we park people from one Burlington Square, some people from one Burlington Square, but they moved the Lake Street to the end of Pine Street, south end of Pine Street.
Jack, do you get much of your demand met through taxi cabs at all?
We do get some. SSTA, which is special transportation, so they go out in the community and pick up patients and bring them to the medical center and to UHC as well.
Many of the, other local taxi cabs, get much business in there? Or?
They get some. Morph Taxi has a handicap van, which I've seen in the front of our ambulatory care facility, so they've been dropping patients off. We get some. And we also have a taxi program where we give, if a patient needs a ride home, through patient advocacy, we can voucher.
Do you have any van pools or shuttles?
Van pools, no, just a regular carpool.
We will be working on van pools, though. Particularly from the Plattsburgh, Grand Isle area, so.
Which, well, I should mention our electronic enforcement. We need to go to some kind of electronic enforcement, whether it's license plate recognition or like UVM has the T2, it's an electronic system for writing tickets. Those types of things. When we go looking in our ambulatory care garage, we have a list of a whole list of license plates, hundreds of license plates. So, and I think in the future you're going to see a lot more transportation demand collaboration, and we do that through CAPA. Sandy, I saw that up here on your website.
How come pricing is not on this list? You said they're free, right, for employees?
Yes.
So, if you charge it, then...
Yeah, it's an organizational decision that we don't want to go to that yet.
Mm.
We've talked about it. It's been considered. But, again, it'd be an employee dissatisfier. I'm not sure the organization wants to go there.
Can you repeat that? I'm sorry.
I was asking why pricing is not on that list mechanism, considering that it's free, and across the little road on the UVM side, it could cost an arm and a leg.
So how much do you think it costs per parking spot in terms of, well, you don't really pay land tax, do you? But I mean, what is your cost per year per parking spot?
I'd have to figure that out. I don't know. I know what I'm budgeted for, but again, it's all combined. If I looked at shuttles and parking leased, but I don't have the cost of what to maintain.
Right.
Be interesting to calculate.
I'm just thinking that the cost of that parking spot that someone's taking for free is a lot more than the $15 gift certificate I'm getting for riding my bike. That it's sure it's an employee dissatisfier, but my goodness, some of those employees are getting a phenomenal subsidization that other people aren't they?
Yeah. When you look at the price of structured parking downtown, just to build the darn thing, it's in the tens of thousands of dollars per space. So.
Yeah. Isn't it general by the average of $11,000 to
Yeah.
maintain and enforce?
A single spot.
Yep.
Yeah.
Spot.
Yeah.
Yeah, that sounds familiar.
Yeah.
That's for
not
surface.
That's
yeah,
not
that's
structure.
surface.
Yeah.
Yeah.
Right.
Is there any incentive for motorcycles or scooters?
Yeah. Oh, I should have a picture of our motorcycle. Yeah. It's not an incentive, but you can on-site parking, and we have a motorcycle area, which is right across the street from this bike. So people go over here.
But you guys are very familiar with that, because that's how we go get the food.
I don't know if you noticed, but we actually had to move it. It was on the right-hand side of that parking lot. We had to move it to the left because the motorcyclists were so concerned about people walking through that parking lot. They were afraid a motorcycle was going to get knocked over. And some of those guys take their motorcycles pretty easy.
So you mentioned that for years, like roughly 61,000 visits, emergency visit, right? So how percent of that is the visit that goes through ambulance? Because I assume that ambulance will not have much effect in the frontier stages.
No, it doesn't. We have an ambulance. We have ambulance parking and ambulance bay there.
Yeah. So how? Yeah, so I just have some idea about the traffic.
If I had to guess, maybe 10%.
Oh, just 10%. So the 90% are walk-in patients.
Most of them are driving. Most of the people who drive into that.
Okay. Right. Because that rate is very close to the rate in a big city like a Pittsburgh. So yeah, I think so. But for big city, I believe that the percentage of ambulance that visit goes through ambulance should be much larger.
Yeah, I don't think it is here.
Is who controls the dispatch for ambulances? Because I noticed the times you walk up there and there could be ambulances from all over the state sort of parked along the sidewalk there.
Yeah.
Yeah. Do they know when they're each coming? And
Yes,
so
absolutely.
Yeah.
So we dispatch for the
You do?
District 3, yeah.
Okay.
District 3 ambulance, there's a radio room in the emergency department.
Right in there.
Right in there. Where the ambulances come in. And they dispatch for all. So they coordinate. So if there were like a mass casualty event or something, and the patients that were triaged in the field, and say it was somebody who didn't need like intensive care, we may divert that person over to Fanning Allen to go to the walk-in care.
Right.
So they're all dispatched from there.
Prevent them from coming in to your facility.
Yes.
Is there any way of you guys tracking what the mode is that a patient comes in on, whether it be pedestrian versus driving? Because there are some great benefits to having Fletcher Allen within walking distance of the city, especially with sort of marginalized communities. And that would be a great statistic to be able to.
Which is why I think it's so important to have CCTA.
Yeah.
We get a lot of patients through the CCTA coming up and being dropped off in front of the CCTA.
Yeah.
I don't have numbers.
Yeah. Is there any way that you could think of
Get that right.
maybe like
The CCTA had those numbers. They don't know who the passengers are, right? So if you get on a College Street shuttle, they wouldn't know.
Yeah, they don't track, unfortunately, most of the transit agencies in Vermont don't track where you get off.
Even if you did, because
They track boarding.
some go to UVM, some go to Fletcher Allen at that stop.
Right. Where you
Some are patients and some are staff.
Right, exactly. So, because we use that to go between our UHC campus and the medical center campus. And one Burlington Square.
Shifting gears, is there a bicycle repair facility or any tools available? I know main medical center has a little shit.
No, it hasn't been a need that I'm aware of.
That's been done as an incentive, again, for people to know, oh, if I get a flat or need tools while I'm there, I can just fix my bike.
I know we would get it for them if they needed it. We have a huge shop. So if somebody would call and say, I needed this, we'd be able to accomplish it.
Covered bike parking is pretty popular amongst cyclists. I wouldn't be surprised if many of those bikes are not in the university.
Yeah.
Not even hospital people.
That's a good point.
I mean, if I was, like in the art museum, and I biked every day, I think I'd park right there.
Yeah.
And with this camera, we've actually caught some bad guys. So people were stealing.
Oh, really?
Oh, yeah.
Wow.
Several. It's helpful.
Another reason to park there for Mississippi.
No, the simple things you did to fence and, kind of limit access in there, I know people who do park there on a regular basis feel like much more secure leaving their bikes there.
So the other thing I want to point out on this picture, so this is a picture of our McClure garage, which is on the north side of campus. This garage was built about 30 years ago, 1984, 85, something like that. So it's starting to deteriorate. And we had a major renovation project last summer and this summer, so it's actually taking 2 summers to complete it. But that's the final product there with the new surfacing, painting. It looks perfect, it looks beautiful. So just figured I'd throw that in there because one of the challenges is maintaining these facilities as well.
So and that counts as part of the on-site number then?
Yes. There's 315 parking spaces in the garage. And that's where we park our resident physicians. So we try to park by groups. We know we can fit 300. There's about 300 residents there, so we put some business needs, residents,
Mhm.
So is any way you can see or do like a screening step first, to know which visit is going to be emergency and which one is just a
Yes.
normal visit?
I can get the daily, what do they call them? So I can see how many outpatients are coming and what campus they're going to, so how many visits are expected.
Yeah, because I am thinking maybe, I don't know, but what policy you're implementing, but at operational level, maybe, are you reserve some fixed capacity for emergency visit, walk-in patient?
Yeah,
Or
it has
you
its
want
own
to do
parking lot.
dynamic?
It has its own parking lot, so
Okay.
the emergency department, there's 50 parking spaces there.
Okay.
And we have somebody at the gate, right at the entrance, monitoring, because it's right near a UVM door. So,
I think maybe what I was wondering is, could you, if you knew you were going to have a low demand for the emergency room ambulatory parking,
allocate that.
could you use that for, say, like night shift?
Yeah. That kind of
You know,
thing.
and the problem is our volumes are so high, it really doesn't.
It wouldn't affect.
No,
Okay.
we're still short 800 spaces.
Okay.
Yeah, I know what you mean. And we've looked at all that, how many patients are coming in this end, how many are coming in. We've looked at that, and it's real.
An emergency is the most sort of stochastic of the operations. You know, you could have an influx of 20 people out of the blue.
Oh, but we'd also tried to figure what you're suggesting at the ambulatory care facility.
Yeah.
So how many people are coming into dermatology, what times, blah, 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 blah. But again, it's so busy, it's always full. So.
Do you have a sense that there's a population of people who pay for private parking near you? Because I'm just thinking I would bike or walk a long way to avoid those shuttle buses myself. The whole idea of getting in my car, parking the car, walking to the bus, taking the bus, walking to my job site. I mean, that shuttle bus, you know, I would bike 10 miles, 15 miles to avoid that. So it's what comes to my mind if I couldn't bike is that, well, I'd just look for somebody nearby who had a driveway and pay them a lot of money
There are
every
people that
month.
do that.
So are there lots of them?
There's a
Or?
physician's lot across the street on Colchester Avenue.
Really?
They sell parking spaces.
So is it like an odd few people, or do you think it might be hundreds?
Is it what?
Could it be hundreds?
I don't know. Sandy, do you know?
I don't, and, I'm thinking about the students as well that, first years that are not allowed to bring a car to campus and might look for a driveway nearby.
Right.
They actually look for our underground garage. $7 a day is nothing to them.
Yeah.
They're coming from New York or Boston or whatever.
And if you buy discount coupons, which we sell, you could park all day for $3.50. Not that I'm suggesting anything.
Well, in other brown bag discussions, we've heard that the garages down in Burlington have much easier ways to circumvent, so you're not the only ones with a problem.
Oh, it's congested. You think you're in Vermont, it's not congested. Yeah. This area is.
In terms of the facility's strategic plan, I mean, I know from a construction standpoint, there's the new towers in the next 5 to 7
towers.
New patient facilities that are going to be done. And obviously there won't be new parking, but you're going to try to design it so you have no net loss of parking.
Correct.
I'm assuming.
And there's no net new beds either.
Right.
So the whole intention of it is to make single rooms, make double rooms that are now single rooms.
Get up to state of the art that is 20 years ago. But that will increase staffing, likely.
Not necessarily.
Okay.
Because remember, we're still going to have the same number of beds. So it's not going to increase. Well, you'll need to clean it. You need to.
Yeah, there's some ancillary. I mean, your department is going to have more real estate to deal with. But you talked about the growth, this idea of growth. Is there a calculus in terms of how staffing will grow particularly at the central facility? And how are you planning that in?
Not that I'm privy to.
Okay.
So I don't have an answer for you. I mean, I know that the only thing we can do, our only solution is to do satellite parking because we don't have any more lots.
And what's the overall budget? I mean, how much do you spend
for shuttles?
For that would just be an interesting and there's other factors going in there of how much of the healthcare dollar is being spent just allowing people access and parking.
Trying to look at I'm sitting here trying to look at my parking line. I remember what it was. It's about $1 million for shuttles and maybe another 600,000 for parking. Of course, lease parking.
And then on top of that are your costs for your staff, all of the staffing and facilitation of that would be a direct parking cost that you'd add in.
A certain percentage of that would be for parking.
Yeah.
So we've got 45 staff, maybe 1 or 2 of those staff would be what would cost that we put towards parking
to really do that monitoring security to make sure that works. And then there's the maintenance budget, which I know doesn't come out of your department, but for facilities in terms of that.
So maintaining blocks.
Yeah. Big budget.
Striping. Yeah.
So what is Fletcher Allen's policy on public access on your property, especially people who are not doing business at Fletcher Allen but may traverse through for one reason or another?
You can walk through. I mean, we're welcome to walk through. We close down the building at 8:30 at night.
So
closed from 8:30 at night till like 5 in the morning or 6 in the morning.
I'm just thinking of, say, UVM doing a campus planning exercise and want to see about how to route people, on this site, which is adjacent to Fletcher Allen, and people who walk and bikes, we don't really think of that, right? So I can see certain access issues in which Fletcher Allen can play a part in improving, connectivity towards Colchester Avenue and East Avenue, and especially the Hills area where there are a lot of informal paths already, and even in the snow you can see where people are trenching down, and you do kind of minimally maintain a path down to East Ave, for example, but as part of that exercise, are you on the table with, and then are there, I guess, what would be the, from your perspective and the operations of Fletcher Allen's perspective of kind of making improvements to those things? Because obviously you're going to have more people, students walking through the hospitals and or the grounds of the hospital, and it would cost you and the reliability issues why you may or may not want people to.
I'm going to show you slides on it.
Sure.
I hear what you're saying.
Yeah, it's kind of a broad question, but I'm just kind of wondering,
So I'm hoping I can show you an example. Yeah. So East Avenue path is over here.
Yeah.
We recently, I don't know if you noticed, we put in this sidewalk here because we had the path, the informal paths that you were talking about.
Right.
So that's an example of how we can improve. You come up East Avenue, and unfortunately, this path that they do to East Avenue is pretty well maintained, even though it says minimally maintained.
Yeah.
But it doesn't meet ADA requirements, so we can't make that a formal path. But we do maintain it, and it's pretty darn good. And as a result of the people who use that going over UVM, this is why we put on this this sidewalk. So we're involved in that planning.
Yeah.
We met with the city and through CAPMA. Those discussions take place. Our facilities planning and development. We meet, so I meet, and our facilities planning and development meet with the Ward 1 neighbors quarterly. So every 3 months we meet and talk about parking and transportation. So we get their input as well.
Right.
In fact, right here, there's a light, push button, and the lights flash, so pedestrians. That was again put in as a suggestion from our Ward 1 neighbors. So we listen. We try to accommodate what we can.
So along those lines, making the pedestrian path from where we are right now to you, which goes around your physician parking lot and comes down the grass hill. So the problem with that is that it's state property, right? It's not Fletcher Allen, and
You're
it's
talking
not
about the lab, where the lab is right?
Yeah.
That's
So probably all of us do the road from here, cross that grass, climb by your parking garage, you go into a back stairwell, across the hospital, then there's a route, and it gets you to
I know it, because our staff take it as well.
Yeah, it gets you to Main Street without any ice.
Walk past the gardens, and whenever facilities piles the snow up and that informal path from East Avenue is covered, I get the call. Guys, gotta clear that. So, yeah.
But it's on state property, it's not your property.
It's not our property.
I mean, have you heard any discussions about a more formalized, like, mid-block crossing that
Yes.
goes? Okay.
I don't know if you can answer that, Cindy, but there's discussions among the city, UVM, about making a what you call it, a mid-block crossing over by the, well, it's actually east of our garage. There was talk of that.
Over Colchester. Is what you're
Yeah,
talking about.
Colchester.
Oh, it's not at Fletcher Place?
No, I don't think that actually.
Right here. I don't know where that stands.
Right here.
But it has been talked
Yeah,
about.
right about where Fletcher Place is.
Yeah, right there.
I see.
I know there was discussion, I've seen plans for it, but I don't know where it's
Interesting.
actually done.
And a crossing with a stripe, like accurate.
With lights,
Because,
lights.
I mean, okay.
Again, I don't know about that. That's a city project.
Watching the wave of students cross,
Oh, yeah.
kind of rippling down across there.
It's like playing Frogger. You just
more interesting with the bike team.
A lot of this stuff is controlled by the city. Yeah. The one I hear about all the time is this one that comes down the hill and onto Colchester Avenue.
Yeah.
And cars are allowed to turn right, which a lot of people say is dangerous at the bottom of the hill onto Colchester Avenue. If somebody's crossing. Yeah. But again, we don't have any control of that. It's the city who would have to put no right on red. Yeah.
And any unique problems with these smaller campuses around the city?
No, one Burlington Square, which is, again, in the city of Burlington. We have challenges there. We use satellite parking for that a lot as well. UHC, which is just down the street here. We park about 140 staff at Centennial Field every day. So there's definitely not enough parking spaces on that. But the smaller campuses, the satellite campuses, Tilly Drive, we've been having some problems with Tilly Drive. And what we did was we striped the parking lot different colors so that employees know that you park in a red spot. That's where employees park. Yellow or white spots are for patients. So it's more like an educational thing and trying to get our staff to park in the back of the lot as well. We also do that at the Fannie Allen campus. Green spaces are for physicians, red spaces are for staff, and white or yellow are for patients. We do color coding.
What can you tell us about helicopter traffic?
I just got the numbers. Our insurance company every year asks for a number of helicopter landings. I think it was 162 or something like that in the last 12 months, helicopter landings. And a certain portion of them were at night, so it's kind of interesting.
And are lots of them from your satellite facilities in Berlin and upstate New York? Or?
Yeah, they come from all over. And the security team meets them, transports the medical team up. So an ambulance and the security team. So the ambulance takes the patient, and we take the medical team. Or it could be organs. We also retrieve organs from helicopters or at the airport.
And the helicopters land at a satellite parking lot, or is that?
No, they fly over by where UVM police are.
You
The rugby field.
Yeah, okay.
And that number was the number of landings only?
Yeah.
And so in a similar vein, I'm still wondering about the ambulances and the network. Because some of the there's some ambulances that are stationed at the ACC here, but then there's obviously like the fire department, they have theirs. And so when they're dispatched out, do you get notified expecting that they're going to come to you? Is there a certain like network that automatically comes to the ambulatory care or?
Well, the ambulance is only bringing patients for the emergency. So if
that's what I'm wondering about, the emergency.
Yeah, it would only be for the emergency one, and yes, we coordinate the entire region.
You do, okay. So if an ambulance goes out of a fire station, you know it's gone out.
And if they have somebody that they're bringing in, we know well in advance that they're on their way. Just like with helicopters, we know well in advance that they're landing, so they all communicate with our radio. We have what's called a HEAR radio system, and it's for this entire region, so all the animals are speaking on the same frequency.
Right.
And there's also non-emergency patient transport that you get as well, but that all comes in through the ED
as well. Some of it comes through the emergency department, and others comes through the entrance, depending on where they're going. If they're going to an inpatient room, they usually go to the emergency department. Yeah. But if they're coming for, say, a dermatology or whatever clinic, they'll go to the front of the ACC.
Have you seen impact from the change in the Medicaid bus pass?
Medicaid bus pass.
We were talking about that at another lunch. I don't know, someone else has.
Yeah, I guess previously, I'm not sure how long ago, Medicaid patients would receive like a free CCTA unlimited bus pass, which the Medicaid system discovered they were using, of course, for all sorts of things other than their Medicaid visits. And so that's severely impacted a lot of low-income communities, but maybe not in aggregate. You're seeing sort of an impact.
No, not an impact that I would recognize. Yeah.
Sort of related to that, your top priority here is service to patients, and it seems like giving patients a place to park that's accessible and is there and available is important. To what extent have you considered trying to group patients and say, if you're just coming in for a routine thing or a lab thing or whatnot, we'll incentivize you getting here some way that's not a car. Other than, I guess, the price is an incentive.
Yeah, it's hard to do, but we have offered patients to park at Fanny Allen campus in Sheldon.
Okay.
So we've offered that, but it's a very, very hard thing to do. Mm-hmm. You really don't get a big bang for your buck by doing it. If we know in advance if we could do that, we certainly would take advantage.
Do you contribute funding to the College Street shuttle? But do we know how that's paid?
We do a payment in lieu of taxes to the city of Burlington.
Oh.
And so I think it's part of that. And out of my area.
Mm-hmm. Is any ambulance conversion policy or practice?
Yes. If there were some type of a mass casualty event where we had lots of injuries, then we would dispatch possibly patients to the Fanny Allen campus. We may send them to Morrisville Hospital or St. Albans Hospital, which that does happen naturally.
How would you get them?
The ambulance that's already transported. Yeah. They would tell them well in advance. Don't come here. At a mass casualty event, they triage the patients in a tag color. So like a red is an intensive care patient, a yellow is a pre-med patient, green is like walking wounded. So if our dispatcher may say if you have a green patient, we're sending you over to Fanny Allen, or we're sending you over to St. Albans.
So it seems like we have a 3 emergency room here in this area.
We have this one here. We have one in St. Albans. There's one in, and they're not ours. They're other hospitals.
So there's the point that when you divert the patient to another ER emergency room, it's supposed to belong to the same owner.
No.
Okay.
No.
Because.
So we would be in communication with that other emergency.
Okay. So one thing in Massachusetts, I just understood about that. In 2009, for example, they found out that actually diversion didn't work. The idea is very nice, like low latency. It means that if they are busy, they say, hey, I'm busy, don't give me more patient. If there are some other guys, available capacity, divert them there. But it didn't work. It's like in chaos.
See, it's usually the opposite for us.
Yeah.
Dartmouth is many times on diversion, so they're diverting patients to us.
Really?
So it's really the other way around.
Okay.
Because we never turn anybody away.
When you walk by the ambulance area, you see literally the whole state, towns, everybody represented with ambulances who are coming to here.
Dartmouth Hitchcock is diverting to you guys.
Yes. In terms of helicopters, no, it could be helicopters. Yeah.
Because they're Teravago all the way up to central Vermont.
Right.
So they're working very blindly as well.
Yeah. To the point where they ban diversion policy, they say, no, hey, don't implement that. It's not getting worse. People was worried, but it's not.
But in Massachusetts, you talk about in Boston, where you may have 12 hospitals in a city block.
And then we already know that. Yeah.
Boston is a real subject.
Great. Well, Thank you very much, Jack. Really appreciate it.